Some of the negative results we're definitely seeing, and I'm sure y'all are seeing it too, is the addiction to electronics and the behavior issues that come out of that, because it's just such an immediate gratification. It's always available. But on the other end of it, the social media has allowed for some sophistication for kids. They are really socially aware. They're politically aware. It's allowed for some really great conversations.
So that's just a little piece there of our conversation with school counselors from around the area this week about how they tackle mental health challenges in Central Texas school districts. And you just heard there from an Austin ISD counselor. And earlier this week on KXAN News Today, we spoke with her superintendent live as part of our Save Our Students project this morning. We're happy to be joined by Dr. Killian of Pflugerville ISD. That counselor there talked about the balance between the tech addiction, using social media as a learning tool. How are you finding that you're able to navigate this, or are you able to navigate this in your district, or what can you do?
It's a tremendous challenge. Our kids are faced with a bombarding of information, and our counselors, our social workers, our nurses, they're all in on all this, and it is a tremendous challenge for us. And that's one of the things we're struggling with as a school district.
So you and I were talking a little bit before we came on the air that we have this Save Our Students initiative we're working on, talking about mental wellness in school. And it seems like 20 years ago or more, this wasn't ever really talked about. Is it that the students have changed, or is it just that we're talking about it more?
I think society's changed, and it's refreshing, because I think mental health was always something back in the background. And so I'm hopeful, because it's out in the forefront now and we actually are addressing it and looking into it, and it's become more acceptable to talk about mental health, that we're moving in the right direction as a society.
Have you found that these issues have kind of grown with the growth of social media as well?
Absolutely. I think that our kids are exposed to things as adolescents that you and I probably never saw.
Yeah.
And it's tremendous for us, a kid to have to cope with all those things without any kind of guidance.
At a very vulnerable time in their life as well. So I want to switch gears and talk about the growth in Pflugerville, because we've talked about this. It is one of the fastest growing cities in the country. Typically we think of growth as being a good thing, but also know it brings challenges as well for a school district. Is there a point where you say, okay, this is as much as we can grow? And how close are we to that point, if there is one?
Well, in our school district, we're not close at all. We're about 60-something square miles, and a lot of people think that the geographic center of our district is 35. It's actually 130. So we're about half grown out, and we've got 26,000 students, so we're going to be growing for a long time.
So projecting that down the road, where do you see Pflugerville ISD in terms of size, let's say 15, 20 years down the road?
I'd say 10 years, we're north of 30,000. Easy, probably even faster than that. We'd easily be 40,000 students, I think, in 15 years.
So how do you handle that then? Because that is rapid growth.
It's strategic planning is what it is. It's taking the time to look at all the data out there, working with our city and our county to make sure that we know where things are going, and master planning the community, because we don't want to end up with road systems that are flooded and we can't get in and out of our community.
So this all requires money then, usually coming from taxpayers in the form of a bond. Is it easier maybe to sell the bond to the taxpayers of Pflugerville, because you can point to concrete things? Literally, we're going to be building this school here, this thing there, as opposed to more nebulous concepts that you might have to ask them to spend on.
You know, it is. But then we also have the pressure of, while we're growing over in one side of the district, we have aging facilities over in the other. And, oh yeah, we built that school, but wow, that school's already 30 years old now. So we have to plan for that as well.
How do you balance that?
Well, you go around the community and talk a lot. And you tell them what's going on, you share all the information and let them make those decisions. You've got to be transparent. You've got to share this, and that's how you start.
Running out of time here, 30 seconds, but as you look at this school year, what do you think is the biggest challenge your district faces?
You know, it's a combination of the growth, and it is the social emotional wellness of our kids. I mean, they're bombarded all the time, and I think we've got some programs out there that are going to really support our kids, and I'm excited about this school year.
All right, Dr. Douglas Killian, thank you very much, and
Thanks
best of luck in the school year. We appreciate it.
This is a digital exclusive as part of our Save Our Students series. I'm here with Dr. Douglas Killian of Pflugerville ISD. I'm Alyssa Goard. Doug, I wanted to ask you, first of all, tell us about what the landscape is of mental health resources that are at your district.
Wow, that's a pretty long list because I don't think the answer for mental health and social emotional learning is one fits all. Well, one of the major things we've been doing is obviously our counseling services have expanded over the years to actually address these issues. Social emotional training that we've done. Last year we had a huge event with all of our staff for training for preparing kids and addressing kids' needs. Our registered nurses are great with our students. They have a lot of training in mental health. And then on top of that, we've got programs that we've started across the spectrum. Last year, we entered in with My Brother's Keeper and started a program at our high school for our young men of color for mentoring and support and to reach new levels with those kids. In addition, we had a person reach out to us from the Seedling Institute, and we are expanding into that area with an outside partnership. The Seedling group works with kids that have incarcerated parents. And then this year, we're working with Johns Hopkins University. We're really excited about this piece. We're piloting at two high schools, a program to look at the depression and anxiety our kids feel, and we're piloting a program there to address those issues and train our staff members.
Tell me more about the Johns Hopkins collaboration.
Well, we're really excited about that. Basically, they're going to come into two of our high schools and they're going to work with our staff. They're going to look at behaviors that our kids have, and we're going to be able to identify some kids that potentially are going through crises and be able to reach out to them.
And at Pflugerville ISD, you guys have a system and an app that's called Anonymous Alerts.
Right. Yeah, and that's been tremendous. As recently as yesterday, somebody reported through our lighthouse about an incident. And then also we had somebody come to administrate at one of our campuses about a kid that made an outcry that we actually sent our police unit after hours to do a wellness visit to make sure that everything was good at home, that mother was aware of this, and that we could address the issue when they came to school the next day. So those type of things have expanded tremendously. That never happened. Beginning of my career almost 30 years ago, we didn't do those kinds of things, and we have that outreach now that we've never had before.
When it comes to the things that people are sending in anonymous tips about, what are the key topics that you're seeing people submit the most tips about?
It runs in cycles to some extent. So after the Santa Fe shooting, obviously everybody was on edge, and so we had lots of tips related to potential school shootings, somebody that might have talked about something. And as sad as it is, some kids were making jokes and things, but we have to take all of those things seriously and run all of those things down to a conclusion to make sure that our kids are safe to come to school. So we get overwhelmed at times, and sometimes there are just things going on in society that impact schools.
And so you're seeing those tips both about potential threats against schools and also about mental health concerns.
Exactly.
If you could have any tool in the book to address mental health or safety on your campuses, what would you like?
I would like more social workers. We added more this year, but I think we need more. I think they serve a very important place for our kids because when you come to school, we know that our major job is education, but it's Maslow's hierarchy of needs. You have to start with their fundamental things before you can reach those next level. If they're coming to school hungry, if they don't have clothing, all those kinds of things, we've got to do something about that. And we're being proactive to get folks in our school system that can take care of those needs for our kids so that they feel taken care of and they can be comfortable enough to learn.
Dr. Douglas Killian, thank you so much for your time.
Thank you. Thank you very much.